Becoming an orthodontist is a process. It's a long process. It's a hard process. Now that you've gone through it, tell us, what was the hardest part, in your opinion? What was the hardest part about becoming an orthodontic specialist?
Well, Doc, as you just alluded to, I think that the hardest part of it is the process. And the reason that the process is such a challenge is the becoming and all that it takes to get through the process. Because becoming an orthodontist and even getting into orthodontic residency doesn't start your D4 year, your D3 year. These are decisions that are made D1 year. And the reason that this decision has to be made is because there's so many integral steps that go into the process of even applying to residency. You have to have the great letters of recommendation. You have to have the great GPA. You have to have the outstanding CV in your resume. And all of these things are not built in 1 year. You know, it is a conglomeration of the work that you do over a course of time. And so being very intentional and directional when you first land foot your D1 year, having that vision to say, I want to be an orthodontist and this is what I want to become. And it kind of parallels to directly what I consider orthodontic treatment. It's a process. Orthodontic treatment doesn't happen overnight. You know, you have to trust the process. It's typically a 20-month to 2-year process. And so being able to trust that and put all of the necessary pieces that exist within that to at the end of the day, to become an orthodontist. So for me, I would have to say it's the process, because once you break that door and you finish across that line and you match, you know, from there, they got to kick you out at that point. And it's hard at that point to mess that up. But the hardest part is truly getting into residency, because there are so many students and not a lot of spots. When you think about how many spots that were available in the college institution, and then you think about the limited amount of spots that are in the dental world to get into dental school. And it's even smaller to get into a residency program when you talk about less than 70 residency programs for orthodontics. And then there are on average, about 5 slots per program. And these are very competitive spots. And so you have to be a competitive applicant. And like I said, that doesn't start D4, D3 year. So really being able to understand the whole process and being able to be disciplined and consistent to actually stay the course throughout the process. And, you know, every night that everybody's going out, you can't be out. You got to study for the GRE, or you got to, you know, be typing up a personal statement, or, you know, doing these other things that will build your resume and build your portfolio that will ultimately be submitted to the match pass application that will allow you to be successful. So it takes sacrifice. And the process is not easy. And especially in a generation that we are in now, everything is a microwave. It's an instant microwave situation, but it doesn't happen overnight. And so you truly have to be committed to those long nights and those early mornings in order to be successful to get on this side of becoming an orthodontist.
The process. Got it. Ortho, the specialty that has been called the mystery of the black box. And that black box has officially been opened and been completed. Stay tuned as we talk to a new doc who is a new orthodontist who just survived his ortho program. He's going to tell us all about it. Stay tuned. Hey, this is Dr. Darwin, a new dentist coach, with another episode of Ask Dr. Darwin on the New Dentist Podcast Show, where we talk about getting into dental school, getting into residency, surviving residency, which we're talking about today, and then life as a new dentist. Guys, be sure that you are continuing to share, to comment down below, also to subscribe, and also join. This content is being supplied for you and curated for you to help you get to the next level, so that you can fulfill your dreams of becoming a dentist and a specialist, and then thriving within the profession. Also, this episode of Ask Dr. Darwin is being brought to you and sponsored by GetIntoDentalResidency.com. Get Into Dental Residency, right down here. The ultimate resource to help you prepare your application, your interview and also your rank list for your specialty and your residency training. For more details, go down below and check that out. Okay. Special guest today. Feel like I already know him, even though this is the first time we've actually met. But I feel like through all the folks that we know collectively and from other orthodontists, other residents, program directors, and other folks in dentistry, feel like we've known each other for a while. But today we're special guest Dr. Remington that's going to be sharing a little bit more about his journey and how he survived his ortho residency. Doc, how you doing?
I'm doing fantastic. Thank you for having me on. Thank you for taking the time.
Absolutely, man. Please introduce and tell us a little bit more about yourself, where you're from, for those that are meeting you for the first time.
Oh, yes. So I am Dr. Remington Richardson. I am born and raised in Louisiana. I was born in Shreveport, Louisiana, but New Orleans is home. I graduated undergrad at Xavier University in New Orleans, and then I went and got my master's of health science at Meharry Medical College. I then matriculated into dental school at Meharry Medical College as well. And then from that point, I went on to do my orthodontic specialty residency at Indiana University and graduated in July of 2023. And now I am currently starting my career as an associate orthodontist with a mentor of mine back home in Louisiana, in New Orleans at Bayou Braces.
Awesome, man. Awesome. Well, welcome back into the profession, so to speak, right? The profession as it relates to now, you get to put to work all the things that you've been preparing for these last, what is that? 1, 4, 4, 8, 12, 10 to 12 years, right?
Yes, yes.
All that hard work is about to pay off or continue to pay off now that you're able to practice as a board eligible, about to be board certified orthodontist. So that's great, man. That's great. Let's jump in, man, because a lot of people are listening and want to hear about your journey and how you did it, because they want to do it as well. Why ortho for you? Why ortho? Why'd you decide ortho?
Oh man, well, ortho for me, you got to think about it. It goes way back into a childhood. And so for me, children with an incarcerated parent represents one of the most significant collateral consequences of mass incarceration in America. And sadly, 1 in 28 children have a parent that is incarcerated. And then unfortunately, when it comes to African American children, this number is increased to 1 in every 9. But I did not let that be a statistic that would determine who I was going to become. And so as I spent 21 years of my life as a child of incarcerated parents, in that time, I quickly learned a harsh reality, and that is the disproportionality of Blacks in the field of America's prison system. But also the sad truth, as equally as alarming, is the disproportionality of Blacks in the field of dentistry. And so fortunately, my mom and father didn't allow their calamity to define who they were. And so my father and my mother were both incarcerated. And when my mother came home, as the role that I was entrusted with as man of the house, because I am the oldest of 6 brothers, as the role that I played as man of the house when she was away, when she came home, she wanted to show her gratitude to me. And so she wanted to get braces for me because my teeth, I got them from my dad, unfortunately. As we know, teeth are genetic, and he does not have the best teeth. And so I didn't have the best. And so she wanted to get braces for me. And so we searched high and low throughout the local area in Shreveport, and we found one orthodontist that, because my mother didn't have dental insurance like most people in America. And when she finally found an orthodontist that would be affordable for my orthodontic care, we started my journey. And that journey, it did such a big thing for me from a confidence boosting standpoint, to be able to look into the mirror and see change happening right inside of me. And I think that people nowadays tell me how I have such a beautiful smile. And I just think about all of those times that my smile wasn't beautiful, but the things that hid behind the smile and the things that I went through in life, that have gotten me to this point through the perseverance, all of that hide behind the smile. But, in our society, image is everything. And so I didn't see a Black dentist or a Black doctor until I was well into college. And so being the first time that I saw this, the role that my orthodontist played in my life, I know that as I've learned more and been exposed to more, that exposure is everything. And there's so many kids that don't get that exposure. And so I wanted to be able to not only provide service, but build and provide an impact, a positive impact, and something that was directly correlated to what positively impacted my life. And that is my smile. Every child deserves to smile. And I wanted to be a change agent. And like the old cliche goes, be the change that you want to see. The change I wanted to see was being the Black orthodontist, the young Black orthodontist that I wanted to be able to see when I was coming up, to change my smile. And now I get the opportunity to walk in every day and not only change smiles, man, but change lives. And so for me, that's why orthodontics, and when I put my first set of braces on in residency on my first patient, I knew it at that point that, this is not only is it my passion, but it is my life's calling.
Wow. Did y'all hear that? Wow. If
Good thing they can rewind it if they didn't.
yeah, they need to rewind it and listen and to that again, because that's a powerful story, man.
Yeah.
And it's interesting how folks get into dentistry, but also how their journey takes them through different parts, or in this case, different disciplines within the profession and the reasons why.
Right.
So for those of you that are listening and watching, that why, your why is very important. No one knows your why except for you.
Yeah.
Right.
Mm-hmm.
Or no one would have ever known your why if you don't share it and don't articulate it. And for those that are applying to ortho or any residency program, that articulation, that communication comes first in that personal statement. So make sure that you're telling your story and giving your why, because you will be asked. And it's a unique way to also differentiate yourself from other candidates, because your story is your story.
It's your story.
Dr. Remington's story is his story. That's his truth. That's his reality. That's his why. So, man, that's just a very, very heartfelt story and narrative as it relates to dentistry and also ortho. And I'm sure there were a lot of program directors and admissions and selection committees that probably wanted to hear a little bit more about that story and brought you in for a whole bunch of interviews.
Right.
Because that's definitely engaging.
Yeah.
And again, even more proud of you of as it relates to now you wanting to be impactful and making the change that you want to see, and how you have yourself seen it through those challenges, and now you're going to be a beacon of light for those kids and those teenagers and those adults that are coming in that want to change their smile, change their appearance, and how that is so closely tied into emotions, behavior, reactions, all of that, all with a change of this, right?
Right.
Yeah.
You talk about the Zoom that brought more adults even into seeking dental care. When you think about orthodontics, we had an influx through the COVID time after throughout COVID of more adults interested in seeking orthodontic treatment due to what they considered the Zoom effect, because more people were spending time seeing themselves on Zoom and not liking the smile that they had and wanting to seek and have change in that.
Yeah. Well, that change happens for people, by individuals like you that are training and becoming experts in the residency program. So let's talk a little bit more about your program, the training environment that you just completed at Indiana University with one of my good buddies, Dr. Kelton Stewart, and the folks in the ortho department there at Indiana University. Tell us a little bit about the program as it relates to what a typical week is like, what type of research is required, and some other things that we'll dive into But first, I want to hear a little bit more about the program, because your program that you just completed may be one of the ones that people are adding to the list or considering adding to the list, but they may not know why they should. So tell us a
Yeah.
little bit more about your program.
And before I tell you about my program, I'll tell you going back to the why. And I think that one gem that students that are seeking to apply to residency have to take into account, you have to know your why before you start applying to programs, because there are about 70 programs. And with all of these programs, unless you have that amount of money, which most don't, you're going to not be able to visit every program. It's not possible. And so you have to be able to find a way to weed out what programs are not for you. And in order to do that, you have to start with your why. And so for me, when I was applying to orthodontic residency programs, I started by looking myself in the mirror before I started applying. And I asked myself, what are the 3 things that I want from an orthodontic program? And the 3 things that resonated with me was I wanted exposure, first off, because in dental school, most dental schools, unless you have an orthodontic program attached to it, you don't get a great exposure to the specialty of orthodontics, because there's so much to learn within dental school. You got 4 years to be trained to be a professional that walks out ready to work. Unlike medical school, they have to go to residency and fellowships. Whereas when you finish dental school, you're ready to work. And so there's a lot of information you have to be able to gain. So you don't really get exposure in that way that would provide you with that specialty. So exposure was the number one thing. I wanted to go to a program that would provide me with a great exposure to orthodontics. Secondly, I wanted to go to a program that provided me with a great network of support. And I wanted it to be support from the program standpoint. I wanted it to be supported from the program director standpoint, because as we've seen, as we've had changes in leadership with Donald Trump and these other and Joe Biden, leadership is important. And so I wanted to be able to have great leadership and have support through my leadership. And so support from my leadership, support from my co-residents. I wanted to be in an environment that was going to be conducive for me to come from an environment where we didn't learn a lot of orthodontics, to come somewhere where I could be vulnerable, I could be supported by co-residents, that we could build a relationship so that we could all become the next best that orthodontics has to offer. And so I wanted support from that standpoint. I wanted support from the staff and from the alumni as well. And the alumni is what brought me to the third point. The third point that was most important for me was a great alumni network. I wanted to be able to learn from the alumni that were at the school, and seeing those that were still being involved in the school. And what could I learn from them with their 5, 10, 20 years worth of experience, and knowing that they came from the same area in this program, knowing, okay, this is what was provided at the program. This is how you can use it and maximize it. Or, hey, this is what I learned that actually didn't work out. And so now, look, let me tell you about this. And so those were the 3 things that I wanted to have going in. And it allowed me to weed out a whole lot of programs that, even just by looking at mission statements from a program on the website, talking to residents, because we're in a social media area. Now you can reach out to a whole lot of residents and get contacts at these different programs and talk to the students and ask the questions that will lead you to your why. And if their why or their answers don't correspond with your why, then that's not the program for you. And so you can weed that off of the list. And so you don't have to apply to 25 schools and you get in or interviews at certain schools and you really don't want to be there. And for me, I didn't want to go to a program that I didn't want to be at. And so with all of those things, I mean, it led me into Indiana University. And how I got to Indiana University, funny enough, full circle, was the Road to Residency talk that you and Dr. Kelvin Stewart did for us at the Harry, man. So talk about a full circle moment coming back here. It's alignment for sure. And so in that talk, we talked about what was the road to residency, what did it look like, what things that you needed to have knocked off for your list, and at what time, and what provided you with these opportunities. And as I sat there and I heard Dr. Kelton Stewart tell the story and talk about Indiana's program, but more importantly, talk about the field of orthodontics, I looked at him and I saw someone that I wanted to learn from. When you think about great players in any sport, all great players had great coaches. And he was someone that I wanted to learn. And I saw that under his tutelage, iron could sharpen iron, and it could make me an even better specialist to do exactly what I want to do, which is change lives. And that's my ultimate goal. And so I wanted to be able to be equipped with the best tools in order to do so. And so by him having that talk, I knew that it was something there. And so when I reached out to him later on, and I was like, hey, I'm really interested in Indiana's program, and I want to learn a little bit more. And man, he took the time to set time aside. Even he has a busy schedule. I don't know how he fits all of that in 24 hours, but he made time to sit with me virtually, because this was during a COVID era, virtually, and show me the clinic virtually, and allow me to have contact with other students, other residents that were currently there, to ask them about their experiences. And all of that led me to decide that, Indiana was the program that I wanted to go to. I applied to other programs as well as I talked to other people, but I had my eye and my heart set on going to Indiana's program because they checked off all of my whys.
Hey, this is Dr. Darwin, your new dentist coach. Hey, look, it's residency time. It's residency application time. And the biggest question that a lot of people have is, how do I prepare my application? So look, if you're struggling in getting your information together, your CV, your personal statement, or you're ready but not prepared for your interviews, reach out to me ASAP, right? Through my group, Dental Residency Headquarters, we can help you. We can help you get ready for this residency cycle so that you're able to do this. We want you to match into residency cycle this year, all right? But you got some work to do. If you need some help with that application, shoot me an email at newdentistcoach@gmail.com, newdentistcoach@gmail.com. And through our program called Get Into Dental Residency, we can help you. But you got to hurry up, because residency application is right now. So shoot me an email right now. All right, let's get back to this episode. Yeah. So now you're there, and you just finished up. Tell us what the program was like, as now that you're in the program, and what your typical weeks were like as a first and second year resident, and a little bit more about the ins and outs of the program.
Yeah. So Indiana's program, it is one of the programs that are 2 years. And so when it comes to orthodontics, you have programs that are either 2 years, or you have programs that are 3 years. And the challenge with the 2-year programs is that you have to learn a lot of the same information that you would have done in 3 years, condensed down into 2 years. And so at times it can feel like a fire hose, because you get so much information, and especially with programs that also have a master's component to them as well, which Indiana did. And so we also had to account for the master's classes. We had to account for our research program, that we had to defend a thesis, write a manuscript, do research. So in order to get the master's for our program. So our first year was a lot of didactic work. We went through the basics. So going back through the anatomy, going back through a little bit of pathology, through perio, through growth and development. So really starting at the ground zero in the basics and working our way up, and to then ultimately get to the second year, which is where we leaned more on just treatment planning and diagnosing and those type of things. Typical week looked like full of class on Monday. We would have class all day from 8 to 5, and even one that runs through lunch with the pathology course. And then we would have Tuesdays would be all class as well. And then Wednesday, we would finally get clinic time. And so we would start clinic in the morning. So at Wednesday morning, we had what was called rounds. And so rounds was like when all of the co-residents come together and a resident presents a case. And you talk about the treatment plan, and it's kind of like a question and answer. So it gives you an opportunity to test your skills and see what you know, what you don't know. How would you treat a case? How would you benefit from seeing what was done in a case? And so the faculty come as well. And so it's a great roundtable discussion that allows you to bounce ideas and treatment plans and diagnosing off of the other people that are in the room. And so that's Wednesday morning. And then from Wednesday morning, we go into the clinic. And then we see patients for the rest of the remainder of the day. From a standpoint, you see about first year, we saw about 5 to 7 patients first year, and then with 1 chair. And then second year, we did 2 chairs. So it was about 10 patients that you would see on a day-to-day basis. And everything had ranged from screenings to consults to treatment plan deliveries to regular adjustments to some surgery presentation. So you really got the full myriad of different types of appointments. And then it was nice because Indiana's program had the big little setup as well. So I had a big in my clinic as well that was right there, which was nice because it was very supportive, because they had been a first year already, because they were second years. And so if I had anything that I needed, or things I wasn't sure about, he shared the 2 chairs right next to me. So we were 3 chairs in one clinic. And for us, Indiana is 14 residents. So it's 7 and 7. And then of that, both first year and second year share 3 chairs. So, do the math on that. But with that, like I said, it allowed you to have the support in that vein. So we had that on Wednesday. Thursday morning was a surgery presentation. So we did surgery classes on Thursday morning. And then we went into the clinic on Thursday. And then Friday, we had clinic all day as well. And then second year, we had a lot more clinic Monday through Friday, and then we had classes spread out in between there. So there was some board prep that was done in there. We had some craniofacial anomalies and development that was in there as well. We touched on some more like treatment planning. We did wire bending courses as well, which was really nice. So just a lot of honing in on our skills from that standpoint in our second year that kind of took us through. And then we would do milestones and research milestones along the way to make sure that we were hitting the courses for the research. And then, like I said, we had a lot of master's classes in the first year to complete that were more like statistics and research-based analysis and those kind of things.
So you mentioned, I heard you mention research.
Yes.
Did you have a research project or
Yes.
a thesis that you had to do, and what was that?
Yes. So the great part about Indiana's program is that if you do not come in with a topic you're passionate about, they do have ongoing projects that need a follow-up study, or, doing different studies in different areas where there's prospective or retrospective. And so you're able to get on other research projects and then just further that research, which is great. But if you have something that you're passionate about, the program is very amenable to that as well, in helping you bring forth whatever the research is that you're passionate about. And so for me, the research that I embarked upon was a retrospective CBCT study, and it was looking at the bony defects of pre and post orthodontic treatment. And so I wanted to look and see when, in orthodontics, a big thing is to extract teeth or not to extract teeth. And with that divergence, it becomes understanding and combing through to see which decision is the best. And so for me, I wanted to take a look and see, because we don't do a lot of CBCTs, when it comes to technological advancements in dentistry as a whole, we're far behind medicine. And so now we're starting to get more of these 3-dimensional x-rays that we're now utilizing. And with that comes an additional information. And so with that information also comes a responsibility on behalf of the clinician to then make sure that you're providing the best holistic treatment possible. And so through the CBCT analysis, we were able to look at what bony defects existed before we started doing orthodontic treatment, and then looked at it to be able to see, what did we do? Did we improve the situation? Did we make the situation worse? Did we not change it? And so it allowed us to really clear up some of these questions that exist. And for me, it was very eye-opening. That made me be even more intentional about expansion within the intermandibular arches or the intercanine width, and how to alleviate crowding and how to provide not only functional treatment and not only aesthetic treatment, but something that is also stable and that is going to be long-lasting as well.
So that's a lot. And
yeah, it was.
Again, it's just part. I mean, it's just part of orthodontics, right?
Yeah,
it's part of that, because you all are the experts. Tell us a little bit more about what you like most about the program at Indiana for you? What was that?
So for me, what I liked most was the liberty that we got from our exposure to so many different modalities of treatment when it comes to orthodontics. So Dr. Kelton Stewart, who's the program director and chair there, made it a point to provide us with the gambit of different appliances, different bracket systems, different wires, different, like I said, different modalities to be able to utilize, because there are so many that can be used. And you have some programs that are, hey, we do it this way, and I'm gonna teach you how to do it this one way, and then we'll move forward with a one-track system. But with Indiana's program, they were very liberal in being able to provide us with, like I said, a host of different treatment options. And so with that, it allowed us to try different things. And also, I come from a dental school in which we stuck with one attending, and that attending helped us through all of our treatment and all of our disciplines. Whereas when I got to residency, I appreciated having specific cases with specific faculty. So I had cases with all of the faculty that were on board there, and all of them had their own way of treatment planning, which was nice because I got to see and try out different systems and different treatment planning. So you get all of these different pieces and spices and parts of a recipe. And then that way you're able to, at some point, build your own secret sauce, because now you have seen it from so many different routes. Now you can then be able to blend together all of these things to decide what you prefer as a clinician. And that's really what residency should do. It should provide you with the ability to think. Because yes, you'll get outside of residency and you'll see different cases, but how you think through them is what is going to be the determining factor of the success or failure of the cases that you treat.
Challenges or things that were maybe somewhat difficult doing the program. What are some of those things? Some of those challenges?
This with, like I said, the exposure. We had a very limited exposure coming into residency. And so starting residency, and you learn there is a whole different world that exists within a specialty, and you really understand why people specialize in different disciplines. And that was a bit of a challenge for me because it was so much that I had never known before. When it comes to tooth movement, it comes to like I said, the biomechanics of moving teeth. When it comes to the pathological processes that exist with tooth movement. All of these things are things I had never considered because I didn't have the exposure to it in dental school, especially not on this kind of a level. And so the growth and development aspects as well. So taking in all of these things and also going into the clinic, because you start seeing patients August of your first year because you got to get the ball rolling. And so it's like you're trying to learn information and apply information at the same time. And and then you get the feeling like it's not sticking and it's not working. And then, just kind of like with everything, at one point or at some point, you finally hit that light bulb moment where it all just starts to click. But getting to that point takes a lot of work. And so I stayed after school a lot of long hours. I would leave on average at about 11, 12 p.m. or 12 a.m. Just staying there, trying to soak up and be a sponge and learn as much as I possibly could. Because you only get those 2 years to be in that capsule to ask all of the questions that you can with the people that are, required, that you paid to help you answer these questions. You got libraries with all of these books and all of this information that you can truly glean from. And so for me, I just wanted to be a sponge and soak up as much as I could within those 2 years. But it does come with its challenges, and it comes with its own stresses, because when you want to be great at something, then mediocrity is not good enough for you. And so you always be even better and even better. And like I said, it comes with its own stresses.
Yeah, learn and apply at the simultaneously at the same time, right? So very important, but also challenging to have to be able to do at a high level within the program. Knowing what you know now and your 2 years, your intensive of 2 years, is anything that you would have maybe done differently or wanted to do differently within the program for yourself?
Let's pause that question. I'm waiting on these kids to stop playing on this this piano right here. All right, we're good. If you want to run that question back, we can circle back to it.
Knowing what you know now, what would have done differently, or would have liked to have done differently with your during the residency training period?
One of the things that sticks out to me the most that I would have changed, and I started implementing it my second year, but I wish I would have done it when I first started. And I kept a pocket-sized composition notebook in my pocket. And I kept it with me in the clinic. I kept it with me in the class. From the time I got to school to the time I left, I kept it with me. And I wrote down every little gem. And so I started it my second year. And I wrote down every little gem, because when you think about it, when you think about phones, we have a backup that's available. When you think about cameras, you have a memory that you can store things on. You have hard drives that we can store things on. But when it comes to the mind, we don't have anything that we can, like, plug in and say, all right, let me store this in my long term, and I'll download all of this information and unload it. And so this gave me a tangible item that I could offload all of the information that I was learning in the clinic. And, whether it was gems of some treatment, elastic rubber band where that one of the faculty members would have told me, or an attending may have told me, how to use an appliance, and, some of their tips and tricks that worked. And so kind of just creating, I called it my clinical cookbook. And so I created this clinical cookbook to write down all of the gems and tricks and things that I was learning throughout my day to day. So that way it allowed me to unload it. And it was something that I could keep with me once I left residency. And I still look at that clinical notebook today. And I still write in it today, and it's almost finished. So I'm about to start volume 2 of it. And so I'll keep these going, because again, it allows me to unload, and it allows me to be intentional about the learning process and the continued education even after residency.
Yeah.
And
Yeah. And
like I said, I just would have started it when I first got there, to even have a whole other element that I would have gotten, my first year.
Well, the fact that you started it was a great novel idea, and innovative to the point where, yes, you will be using it,
Yes.
and possibly even sharing it, right?
Yeah.
Maybe at a future study club, ortho study club that you may be a part of or may head up or something like that. Because
Right.
you're right, it's lifelong learning. That's part of our
Yeah.
profession and what we do, lifelong learning. So that journaling exercise for those 2 years, that's a great
Yeah.
idea. Glad to hear you decided to do that.
Yeah, and it's something that I implore to other students when they ask me, when it comes to, hey, what did you do in residency? Or, what could I be doing now? And I tell them to do it even now while you're in dental
Oh
school.
yeah.
It's
Oh
a
yeah.
great.
Oh yeah. And it sounds like it's a challenge, and there's other things dental students have to get through, so they may not get it. But
Right.
residency, you better get
You
it.
better get it.
You
You
better
have
get it so you can get
to.
it.
Gotta get it. Gotta
Right?
get
Because
it.
like you said, that time is limited. Them two
Time.
years or 30 months are up.
Right.
That's it. That's it for that environment. You'll get it
Right.
more going to AAO and going to other international
Right.
conferences and study clubs and things like that. But you're right. That clinical cookbook is something that you're going to savor forever.
Right. Right.
Forever and ever. And you being down there from Louisiana, y'all like to savor some good stuff. So why not the
Exactly.
clinical cookbook for ortho, right?
Right. Right.
That's awesome. Ortho, again, as we've been talking about, is a very, very highly regarded and aspired discipline in dentistry. A lot of people applying to ortho, like you said, over 70 programs, or around 70 programs, anywhere from 4 to 5 on average. So there's not a lot of spots.
Right.
So people need to know, about these spots, more specifically, the spots that are going to be given to the top candidates. So what do you think, in your opinion, are some of the qualities and things that make an individual, an applicant, a great or an outstanding candidate for training in ortho?
I think, one, the ability to tell your story. I think a personal statement is a very unique piece of information that no one else will have. I think that when it comes to a lot of the CV information, a lot of those CVs will look alike because a lot of these candidates are competitive and a lot of them will be interchangeable in that way. A lot of people do leadership, a lot of people do community service. So, those are things that, yes, they are important to have because you want to be competitive and you want to be an interesting and unique candidate. But the most unique thing you have in your package is going to be your personal statement. And so everybody has a story, but not everybody can tell their story. And that's going to be one of the key things is telling your story and letting people know, one, the personal aspect, but also the statement of that personal statement, why you feel like they need you in their program, what they will benefit from of value to having you in the program, and why you're that ideal candidate. So telling your story, but also correlating your story to why it is you're fit for this position. And so I think that's one of the most important things. Secondly, it's going to be your GRE score. You got to do great on the GRE. Your GRE is like the DAT for dental school. It is something that allows you to be set apart. It allows you to be competitive. It also allows you to level the playing field for students that will be coming from programs like UCLA, for example, where they don't have a GPA. Everything is pass fail. So this is something that is put in place in order for them to level the playing field and see where students really stand. But also the GRE shows, can you, with everything else that's going on in dental school, can you sit down, study, and focus and excel on an exam that has nothing to do with what you're currently working on? Because the GRE is vocabulary, it is writing, and it's math, verbal reasoning, and quantitative reasoning. So it's something that's completely different from what you're doing on a day-to-day basis in dental school. So that was one of the other challenges that existed while I was in dental school and applying for residency. It was finding and carving out that time to actually study for that exam that had nothing to do with anything else that was going on in dental school. And so while some of my friends were out or they were, having fun on the weekends and doing and on vacation and those kind of things, those were sacrifices that I had to make to spend that time to study for this exam because I knew what it was that I wanted at the end of the day. And I knew that when match day came, I wanted to open an email that said congratulations and not unfortunate. And so you have to have that end goal in sight. And so you have to make those sacrifices on the front end. And so providing a great GRE score is something that, because there are so many applications that come in, it's one of the first things that people are going to look at. Interviewers are going to look at your GRE score, they'll look at your GPA, and then if those two things are competitive, then they'll dig a little bit more and see, okay, well, let me see, what this personal statement looks like, what the CV looks like. But that's really your gatekeeper, your GPA. So, you have to do really well, and GPA doesn't just start again. It doesn't start D3, D4 year. GPA starts from your first time you sit down in class, D1 year. And so you got to have that intention and direction and know, hey, like, I'm in this class D1 year, but I got a vision for where I need to be in 3 years and what I need to provide in 3 to 4 years. And it starts today. And so that's part of that process that you have to lean into. And so those are three of the biggest things that make an ideal candidate. Personal statement, because it's unique to you. Great GRE score, because it allows you to be competitive when you walk in that door. And when I'm saying door, I mean proverbial door, which is your admissions going in, your application. And then after that, it's the GPA. Those are three of the biggest things that make a competitive applicant. And then from there, if you can find anything that relates to orthodontics that is unique, then that also can give you some extra oomph in your application, an extra bump that would make it be interesting for people to want to say, you know what, I want to interview this guy, or I want to interview this young lady and see, I want to know more. And that's what you're providing when you submit that application. You want them to see it and want to know more and extend you the offer for an interview.
Yeah, four very, very key things.
Yeah.
And I can tell you two of them are going to put people overboard. That GPA, because a lot of people are going to have that, well, I don't know if my GPA is good enough. I have some self-doubt because it's just unknown, which, yeah, it is unknown. You're not going to know unless you do a study, or unless IDEA does a study of all the applicants for each of the residency programs, but specifically for ortho, what all the candidates' GPA was that applied, and then those that got in. Unless there's a study that has been done by IDEA, you're not going to know. No one's going to know. But it also means that the GPA that you have, it doesn't mean that the GPA that you have may not get you in. It could still get you in because you have other things, right? You got your class rank.
Because it's still a sliding scale. You know,
you got a
if
sliding
you don't do
scale.
well on the GPA, you need to do better on the GRE. If you have a better GPA, well, then maybe you can afford a few more points on the GRE. So it's definitely a sliding scale that you have to balance to make you a well-rounded competitive applicant.
Yeah. And the second thing about is the GRE, right? Not all programs require the GRE. So quote unquote, it's optional. Some programs, no, it's required. You got to take GRE, and because of that, some candidates will immediately take that program off their list. Oh, I don't want to take another test. I don't want to take another test. Okay, that's fine. But keep in mind, you're limiting the number of possible opportunities for yourself. Plus, keep in mind, guess what everyone does after they finish an ortho program? Whether they go to a program that requires a GRE or not, guess what you're going to be doing?
Practicing orthodontics.
You're going to be practicing orthodontics, but in order to practice as a board certified orthodontist, you're going to be taking that board certification test. Yes, another test. So my point is, you're not going to be able to skip around and bypass any more tests. Sorry, but just it's all relative. So yes, a lot of people are going to be worried about the GRE. There's prep courses, things that you can do. And also keep in mind that it may be a way to set yourself up for uniqueness and differentiate yourself by taking the GRE to maybe offset and complement your GPA or what you think is a lower GPA, but also stand out. Because if you took the GRE and you're applying to a program that doesn't require it and they see it, they may think, I don't know, either this person is applying to programs that have that require GRE, or this person took the GRE even though it was optional. I've had a couple former residents that have done that for pedo and taken the ADAT when it was not required by pedo programs. She took it, one or two of them took it as a way to say, hey, I'm different. I'm going to do whatever it takes.
I'm willing to do more.
Yeah, I'm willing to do more. Right. And that's just a decision that you have to consider for yourself. Everything's not for everybody. Everybody's not for everything. And that is the case for the GRE as well. So some great things that you shared about what makes an outstanding ortho applicant. And all of those applicants and folks are listening and watching right now, right? And they're listening after they've stayed all the way through to listen to this part, which is tips, advice. After you have gone through this process and have survived ortho residency en route to becoming a board certified orthodontist, what are some tips and advice for those individuals and candidates that are applying to ortho that they must do or should do right now?
Start early. Start early. Start early. It is a long process. Build relationships. If you know that orthodontics is something that you are interested in, then start D1, D2 as early as possible, because you're going to need people to write great letters of recommendation for you. You're going to need a CV and a resume to write that exemplifies all of the great characters that you have. You're going to have to take the GRE. You're going to have to do all of the things required. So I would say start now. Start building relationships with the people that will eventually write the letters of recommendation for you. Start looking at avenues and leadership positions that will lead you into great positions that are good on paper. Not only are they good service, but they're good on paper. So with all things that you do, start now, but also be intentional and be directional. So every opportunity or every office or service thing that you do, it should have intention behind why you're doing it. And with everything that you're doing, it should have direction. And honestly, that's orthodontics. When you start a case, you look at the end goal. When you look at that patient's mouth, you're looking at the end goal. So everything I'm implementing throughout treatment, I have intention behind it, and I have a direction into which I'm going for. And so everything should be intentional and directional as you're making and building this application. Because like I said, the application does not start D3 year and it doesn't start D4 year. Additionally, I would tell you to reach out to programs that you're interested in. See if they have opportunities for you to come and do externships and shadowing experiences. And do not think that you going to do an externship is going to give you favor in that program, because most people look at externships as that is for you, because it is. It's for you as an applicant to see what this program looks like on a day-to-day basis, and is this going to be a good program for you? So yes, you can put it on the resume, but if I'm applying to Indiana and I did an externship at LSU, Indiana's not really going to care that I did an externship at LSU. That I didn't come to Indiana to do it. So you can put it on there and let it see that, hey, I've done some externships, but don't think that it's going to be your route into that program. But when you go to these programs, do know if this is only take externships where you're intending to go, or at least considering. And if so, then make great impressions. Don't go there and be shy. Don't go there and not be yourself. Because what you don't want to do is go somewhere and not be yourself and get in. And now you got in not being yourself. So you're never going to be able to be yourself when you get there. You're always going to feel like things are stressful and people don't have your back and you're not in a great place and you're not where you want to be. Well, you didn't stay true to yourself when you initiated that process. So you got to do that. And then lastly, the bit of advice that I would give for students that are on the other end, which is the actual interview cycle and application cycle. When it comes to the applications, again, look yourself in the mirror and ask yourself, what are the 3 things that I want from an orthodontic residency? Write those 3 things down and take those with you as you explore all of the other programs. And if they don't match your 3 things as to why, they don't fit on your list. Keep those in mind. Then from that standpoint, reach out to all of the everybody that you can. If you reach out to a program and ask the lady that answers the phone, make friends with her and ask her, hey, I'm interested in the orthodontic program here. Is there anyone that would be a resident that I could talk to hear about the residential experience? Everybody has a chief resident. And so the chief resident is normally the person that fields those calls, but it gives you a direct into the program, because now you can also learn about somebody else's experience in that program outside of just seeing the brochure on the website. Lastly, I would say when it comes time for your interviews, when you go to the interview, understand that yes, they are interviewing you as an applicant, but you are also interviewing them as a program. So go there with that power in mind and understand, is this program for me? Do they do things that I like? Is this something or somewhere I could see myself at? How do I mesh with the current faculty or the current program director? You know, when I get here, how does it feel? How does it look? How does it smell? Is this my space? And take that in with you. And that way you don't feel so stressed out that, oh, I'm under this microscope of being interviewed, but you can walk in there with the power and say, I'm interviewing you all as well. And the interview should feel like a conversation. It should feel like, you know, we're having a conversation about what it is why I want to do orthodontics and how you can help me become the best orthodontist possible. So those would be some of the tips and tricks. And other than that, everything else is more specific, and I'd be more than happy to share with anybody that had any questions that wanted to reach out to me offline.
Man, you just shared some Louisiana hot tips, baby. as y'all say down there, baby.
Right.
Y'all, 5 tips. Listen, if you all are getting some value and learning some stuff that can really help you, please, in the chat, in the comments down below, please say yes, Dr. Remington. Yes, Dr. Remington, in the comments below. He just gave us 5 fire tips starting early. And yes, keep in mind, yes, we know everyone doesn't know by D1 or D2 year they want to do ortho, but guess what? You still got to start. So even if you start D3 year, you just got some work to do. You may need to do an ortho internship. There's programs across the country where you can do a 1 year internship,
And then Darwin,
or maybe even having to do a GPR AGD residency as well.
right. And then let me clarify that point one just a little bit as well. Even to the ones that don't know D1 and D2 year, you know that even if you want to consider specializing, you're going to have a great GPA. You're going to have good letters of recommendation, and you're going to have a good resume. So these are things that even if you don't know what field or what specialty you want to go into, you still have to do these building things in the process.
Absolutely.
That way,
Second one. Oh, go ahead. Yeah, you got to keep those options open.
Yeah.
And the earlier you keep them open, the more doors you can walk through later on, right?
Confident. Exactly.
Again, confidently. And that's the whole reason of starting early, because you don't get no time back.
Okay.
you don't get no time back. I can't get that jet black curly hair I used to have back in the day. I can't get that time back. And anything else that's an attempt to, it don't last very long. So, so you don't get that time back. So take advantage of the time by starting early. Second thing, contacting programs, especially those priority programs, or those programs that are kind of like tops on your list, that you think are tops on your list, so that you can reach out and do some shadowing or externship opportunities. Determine the three or four things that you must have in a program, right? You must know those things, and that'll help you sift through the programs that you're considering as well. Number 4, talk to the residents that are there now if you can. Again, the power of social media. A lot of these programs may have, if you find out the names, a couple things on their website. Some programs will share and identify the residents in the PGY 1 class or the PGY 2 class, right? The first year or second residents have their names up, have their places where they're from, schools they went to. You know, you want to be looking for those things. Plus, some programs will have may have a YouTube page, but they may have an IG page. I know I had a couple clients that applied to UCLA, and we found IG pages, and the residents and the staff. I mean, you could really see the culture, or learn a little bit more about the culture just from what you saw on social media. So same thing goes with trying to find out who those residents are and talk to them, right? They're going to give you the inside track. Some, as you will find, don't want to talk because they just maybe not happy, or they're too busy, or, but there are going to be some that will tell you everything. You got to find those folks. And then the fifth thing was making sure that you are asking questions of the program too, because it is a two-way street. For most ortho programs, they are in match, which means they have to come up with a list and a rank list of candidates that they want, 1 through 5, 6, 10, and so do you. You got to come up with your rank list. So you've got a job to do. You can't do that job if you're not asking questions and making sure that after your interview, you are making an assessment as to, all right, how did it go? Do I see myself here? What things can I contribute to based on what I've saw in this environment? Those 5 tips, Doc, are massive. So for those of you watching and listening, again, if you got some value from what we just talked about with regards to tips and advice, and you're a candidate for ortho, please put yes, Dr. Remington, down in the comments below. We need your comments, and we want to know how this information is helping you. And it's been very helpful, I think, to get an overview about the program in Indiana, your approach, your story, and some of your opinions based on what you think makes a good or an outstanding ortho applicant and some tips. This has been great, Doc. What's the best way for people to get in contact with you if they have some additional questions or want to talk to you some more?
Feel free to. The three best areas to reach me, I would say Instagram, just because we're very social media forward these days. So Rich Smiles _ is my handle. So RICHSMILES Smiles _. So Rich Smiles _. You can find me on LinkedIn as well, Dr. Remington Richardson on LinkedIn. The other one is my email address. So richardson.remington@gmail.com. So last name dot first name @gmail.com. And then lastly, feel free to contact me by phone. My phone number has not changed since the 7th grade. So it is 318-518-4338. So those are the three best ways to contact me. Like I said, by all means, I'm here to help. I feel that we are best as a society when we lift as we climb. And I got where I am because other people supported me to get to where I am today. So it's only right for me as a civilian, right, to make sure that I continue to help the other ones that are looking to be in similar and better positions than I am.
Yeah. Well, Doc, thanks for being so transparent and sharing all of that as far as contact information. Professional inquiries only, please. All right.
Please.
Doc is busy. He's on a mission to change lives, one smile, one arch, or maybe in some cases, well, most of the cases, 2 arches at a time, right? And so feel free to reach out to him as he continues to be a beacon and shed light about surviving ortho and becoming a board certified orthodontist. All right, this is it. Go back, listen. Most importantly, implement. None of this is any value if you all do not implement,
right,
and take the action steps and do what's been discussed. And I got one more thing I want you to do. Go to the next video. Go to the next video right now. Go, 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 go.